Hi guys, this is Drew from MoveUP. So I'm going to take you through a hip flexor stretch. This is a kind of a rec fem psoas iliacus type stretch, and it's often one of the stretches that's hardest to perform and performed often fairly incorrectly. And there's a reason for that, because it's actually hard to get into the right position. Okay, so I'm going to run you through it and show you how to do it. So hip flexors are our big, strong muscles on the front of the thigh. Okay, and there are two big ones particularly. So we've got iliacus, which comes off the inside of the leg and comes up in deep into the pelvis here. And then we have psoas, which starts at the same place as iliacus, shares a common tendon with iliacus, but then comes up across the pelvis and into your 5 lumbar vertebrae. So if our hip flexors get tight, it often makes our lumbar vertebrae do this, into what we call an anterior tilt. Okay. Now we want a little bit of anterior tilt, and a little bit's okay, but excessive anterior tilt, not cool at all, puts a lot of pressure on the joints, puts a lot of load in through those lumbar segments, and it can cause wear and tear and lots of mechanical back problems, sciatica, and a whole range of issues. So often we need to kind of get this rectus femoris and our iliacus and our psoas all relaxing, so we can really bring this pelvis forward into more of a posterior tilt. If this is on too strong, then your butt muscles are going to be a little bit weaker because they can't move through this posterior tilt. Okay, so they can't get their maximum contraction because it's stuck here. You can still use your glutes, you're just not going to use them optimally. So this stretch is all about getting this flexibility through the hip flexor. Now, to get started, come up into our traditional hip flexor stretch. Now what I often see people do is they get here and they come lunge forward straight away, which looks kind of cool and it's kind of sexy, but it's not really an effective stretch. It's a bit more of a rec fem kind of stretch. It's not really a psoas iliacus. To get the psoas iliacus, what we need to do is reverse the action of those muscles. So a strong psoas is going to create an anterior tilt. So what we need to do is create a posterior tilt. Okay. So we've got to get this kind of tummy on here, glute on here, squeeze and squeeze, and then we tilt the pelvis posteriorly. So if you imagine you've got a bowl of water, okay, if you tilt it forward anteriorly, the water's going to come out the front. Okay, if you tilt it posteriorly, you're going to tip water out behind you. Okay, so we want to get that more of a neutral position. Now, often people will struggle with this if they've got really weak abdominals because they've been in this position so long, the abdominals are in a weak position as well. And you need a little bit of ab strength before we get into this position here. So I often working with clients who've got long-term back pain and they can't actually get into this position because they don't have the abdominal strength to maintain that posterior tilt. So this is usually an exercise I'll say to my second program, okay? Or I'll teach them a simpler version of this rec fem stretch, so it's hip flexor stretch on the floor, okay, which I'll show you in a minute. So come back up, set it, make sure that this front foot can look past the knee, you can see the tips of your toes, absolutely important. Okay, you don't want to be having your foot underneath here, you're not going to have the stability, and you're not going to be able to give yourself the leverage to come forward into the stretch. So bring this foot out forward, square up your hips, okay. Make sure that you've got a straight line, rear foot, front foot, okay, good. Lift the chest up, belly brace on, glute on, shoulders back and down, tuck the chin, lift the head, so get that full energetic connection between all the soft tissue structures. Okay. And once you do that, often you'll get a stretch into this hip flexor here. So you're really stretching then kind of iliacus psoas, really hard to separate the two. Don't allow the body to rotate out, you've got to keep this straight. Okay. Alright, the iliacus and psoas kind of are coming down on this oblique angle through here. Okay. And if they're tight, they'll want to pull you out in this direction. So just straighten your hips up, it's kind of going to do this to that muscle, it's going to put it on stretch. Cool. So once you've got the stretch on, then whole body comes forward as one unit. So think hip, shoulder, ear, stay in line, and the whole body just shifts forward into a lunge until you get the stretch you need. And you go as far forward as you can until you start to lose that neutral spine and you break into an anterior tilt. As soon as you get pulled in that anterior tilt, got to come back, reset it, set it up, and come forward. Cool. Now I do a lot of cycling. Cyclists have always got tight hip flexors. This is the nature of cycling. It's the trade-off of any sport. You know, you're going to have pros and cons. So as soon as I get into my posterior tilt, I can get a nice stretch there straight away, and I'm happy. That's all I need to go. If I want to make it a little deeper, I can take the arm that's on the same side and reach up towards the ceiling. Think about the little finger reaching towards the roof and push the rear foot into the floor. Hold. Belly brace on. Take a big breath in. Breathe out. Push the rear foot to the ground. Lunge forward. Hold. Breathe in. Breathe out. Belly brace. Push your leg in the ground. Hold. Relax. Come forward a little bit further. Breathe in. Breathe out. Belly brace. Push the rear foot in the ground. Relax. Hold. 3, 2, 1. Release. And that is how you stretch out your hip flexor. Alright. So it's quite an involved stretch. There's a lot going on. Sometimes I need to regress a little bit, do a little bit of TA training, a bit of abdominal bracing,